And now on WRS, Michael McKay with the McKay Interview.
Hello everyone. This is the second in my mini-series recorded on the 22nd of April, devoted to a broader and fuller understanding of the Covid-19 coronavirus pandemic, which has beset us all for the past few months. It's causing illness, death of family and friends, and huge disruption to our working lives in almost every country in the world. Today I've invited someone with hard and proven experience in another country that had been affected quite seriously by the SARS epidemic some 17 years ago. You probably remember that that was a deadly species of coronavirus that infects humans, bats, and certain other mammals. We can all learn from him. My guest today is Mario Possamai, an old friend who by profession is a forensic investigator and author, and was senior advisor for 4 years for occupational health and safety and pandemic planning on Canada's SARS Commission. That was the judicial inquiry into the outbreak of SARS in 2003. It was styled as the first major epidemic of the 21st century and ominously a dress rehearsal for the COVID-19 pandemic. Mario was the Commission's chief investigator into death and illness among healthcare workers, who comprise about half of all SARS victims in Canada. Hello, Mario. Thanks for making time in Toronto to join me on Zoom with our listeners on the McKay Interview.
Thank you for having me, Michael.
It's good to talk to you again and good to see you on the screen.
Lovely.
Mario, you were closely involved with the SARS pandemic, that is severe acute respiratory syndrome in your country. Please tell me briefly why and what your particular areas of knowledge and expertise were or are that led you to play a role in that important story.
So I had the opportunity during SARS under Justice Archie Campbell to delve into sickness and death amongst healthcare workers during SARS. So in Canada, about half of all healthcare cases involved healthcare workers, rather. And so I investigated circumstances under which they fell ill and the lessons to be learned from them. Now, healthcare workers are really important during a pandemic because illness among them is like the canary in a cage, in the mine, rather. So if healthcare workers get sick, it's a sign that the whole containment effort is on the wrong path.
I read recently, Mario, in a published magazine, an article in which you were quoted as relating some of your SARS experience then and your worries now with regard to public health emergencies. And you quoted the famous words of the American philosopher George Santayana, "Those who cannot remember the past are condemned to repeat it." Why did you quote his words and what did you mean? And for those of us who cannot recall what happened then, after all, SARS occurred almost 20 years ago, please quickly remind us of the salient points of that public health emergency, what it had in common and its differences with today's COVID-19 pandemic.
Well, that's a great question, Michael. So SARS was caused by a coronavirus. That's a cousin to the COVID infectious agent of today. SARS was much smaller than the current pandemic. About 8,000 people died around the world. It affected only a small number of countries. And it was fairly easily contained by comparison to what's happening today. But many of the issues that we're having today, dealing with the pandemic, we saw on a smaller scale during SARS. So for example, shortages of PPE, the difficulty of having public measures like lockdowns.
And PPE is personal protection equipment.
Personal protective equipment, right?
Yeah.
You know, the 95 masks that health workers have to wear, things of that nature. There were other issues like debates over what kind of protections that nurses and doctors should wear. Should they wear only surgical masks or the higher protections of N95s? There were worries about what it would mean to an economy to have a profound and extended lockdown. So many of the things that we're experiencing now, we experienced then, but unfortunately, I don't think that the world has learned the lessons as well as we could have from what happened during SARS.
Today, my guest is Mario Possamai, speaking to me from Toronto via Zoom, who was a member of the SARS Commission, the Canadian judicial inquiry into the outbreak of SARS in 2003. Mario, you work closely with government and even inside government. Please share with me your thoughts on the relationship, when it exists, between government, and by that I mean the executive, that's the government, politicians and policymakers, and the bureaucracy, the civil service, the implementers of policy, and the scientists, the gatherers and interpreters of data. This relationship must be very important, and at the very heart of good outcomes, especially in times of crisis, but few of us have had that personal experience. So please tell me, in your view, and tell me where weaknesses can appear in the system, how to strengthen them in times of crisis, and put simply, what can go wrong in government and how best to avoid it.
That's really a very, very important question. One of the issues, one of the challenges during a crisis like this, because it is an extended crisis, is that politicians are very concerned for their electability, for their popularity, things of this nature, and they have to implement policies that are not popular and that may extend far beyond ordinary people's tolerance. And in that regard, they have to show strong leadership, and they have to show a certain understanding of science, but they have to rely on science. What can go wrong is that a politician, the executive, may not understand science. The politician may get advice from non-scientists, and at the same time, the politician may not have the right mix of scientists to give the right advice. So all of these things can go wrong, and it takes smart leadership to be able to navigate through those issues, and it takes a professional, well-oiled machine of public bureaucracy to support the kind of decision making, and to be able to make the kind of nimble changes that may have to be made to ensure that the right policies is implemented and undertaken.
And did you see examples of that during the SARS time, that the politicians maybe were confronted with competing opinions, competing theories of scientists, and had to make a judgment? Because, I mean, science, and we had Bob Bishop on this program just last week, who is a scientist, a mathematician, physicist, and who said, nothing is written in stone in science. So these are theories that are put up for debate and argument. That's the strength of science.
That's exactly it, Michael. But one of the debates that we have today on the pandemic response is COVID spread by airborne or only through large droplets? We had the same debate during SARS. And at the heart of the debate is the fact that good science, takes time to reach results. SARS did not, rather, the first evidence that SARS was airborne did not come out for about a year after SARS. So it took a year for us to determine that. In the interim, governments have a choice. Do they take a precautionary approach, protect healthcare workers to a higher level until the science becomes more readily apparent, or do they go to a base level of protection as the WHO is recommending? So it's a precautionary approach, or an approach that says we'll only go with what we know today, and if the science changes, we'll change it then. And that's the debate that's going on now. And politicians have a very tough time navigating that one, because on the one hand, they want to make decisions based on facts. But the smarter way to go is to be cautious and say, let's wait for science. Let's give science time to really figure out the right answers. In the meanwhile, let's protect our healthcare workers on a precautionary basis at the highest levels, and take the same approach to protecting our population.
It's an important answer, Mario, and it's my last question. I'm going to approach it from a slightly different angle, just to give you the chance to expand a little bit on what you said for the benefit of our listeners. We're not through this public health crisis yet by any means. What would your advice be to decision makers in government who may be at a different position today on the graphic curve of severity, even danger, to protect their citizens in the most effective way possible? And related to that question, what you just touched on about precaution, let me add another one regarding the significant and ongoing debate over how COVID-19 is transmitted. In your opinion, is the evidence conclusive, or should we be more guarded in drawing conclusions and therefore formulating government policy too quickly, even though the public collectively all demand a solution and a cure. And obviously here I have in mind those afflicted by the disease, but also health and care workers, as you just explained, who are exposed daily to great risk. I'm just curious to hear you expand a little bit more on that, Mario.
So I think my number one advice to decision makers is keep your eye on the health and safety of the healthcare workers. If they're not protected, then nothing positive can happen. And I'll give you an example.
Yeah, please.
When you look at China sent 40,000 health workers to Wuhan in late January, early February to help combat the COVID outbreak. Not one of them got sick because they were being protected at a high precautionary level. In Ontario right now, about 11% of healthcare workers are sick. In Spain, 17% of healthcare workers got COVID.
And just to be sure I understand, the Chinese, they became ill because, they didn't become ill because they were tested and they had the correct clothing. Is that what you're saying?
That's exactly it, Michael. The Chinese were able to protect all 40,000 workers using airborne precautions, N95 respirators, on the precautious basis that COVID is spread through airborne. In Ontario and in Spain, healthcare workers are not protected to the same level. Neither are they in the UK. And you can see that the containment effort in countries where healthcare workers are not protected are not effective, are troubled, and there's much greater disease and death amongst the population.
Thanks for being so helpful, Mario, and thanks for being so enlightening on my rather simplistic questions, but it's very interesting to hear what you had to say. It was very good to talk to you. My guest today has been Mario Possamai, formerly Senior Advisor for Occupational Health and Safety and Pandemic Planning on the SARS Commission, the Canadian judicial inquiry into the outbreak of SARS in 2003, and we've been talking via Zoom. Many thanks, Mario.
That was the McKay interview with Michael McKay. And don't forget, you can hear that interview again on our website, worldradio.ch.